In this video, I wanted to cover a question I got from a massage therapist enrolled in one of our training programs on the role of degeneration in the clinical presentations of the injury and if it's even possible to address it within the scope of massage therapy. For those of you that don't know me, my name is Dr. Matt Maggio. I am the creator of the Peak Method and the founder of the Soft Tissue Revolution, where we teach manual therapists a new treatment system that does focus on working smarter, not harder, which will allow you to cut your treatment times by at least 50% and in some situations like 75 to 80%, so you can stay healthy and avoid burnout and help a hell of a lot more people get out of pain and stay away from pain pills and surgeries, which only make things worse. This question came in from a massage therapist currently going through our immersive CU training program. And the question was, you mentioned degeneration. As a student of the Peak Method, are you going to teach me how to differentiate between scar tissue and degeneration conditions? And if it is degeneration, is that within my scope of practice as a massage therapist to help out? So I get these questions a lot from massage therapists, especially ones that are reaching out to learn my system. They're like, well, you're a doctor and it's a different scope of practice. I even got into a LinkedIn argument with someone about this. They're like, well, it's just different for you because you're a doctor. I'm like, well, yeah, I get it. It is a little bit different, but at the end of the day, it doesn't keep you along the obligation of knowing what's wrong with the client. A lot of therapists ignore the whole evaluation side of things because they can't legally diagnose. And here's the thing. You can't fix a problem if you don't know what it is in the first place. So you might not be allowed to say to the client, yeah, you have degeneration, but in your mind they do. And it is important in the treatment process and what you do. So recognizing that degeneration is very key. And so many manual therapists. I remember I had a call with someone like a year ago and I was reviewing a case to help them out, and they just couldn't fathom the idea that it wasn't just a soft tissue problem. They were like, it's just got to be a tight muscle and it's got to be a buildup of this and inflammation and that. They couldn't fathom that there could actually be a problem with the joint or the cartilage or anything like that, even when it was a really chronic and pretty severe problem. So there's 7 tissue-specific problems in the injury presentation. These are the only 7. I call them the musculoskeletal problems. You can have a bone problem, you can have a cartilage problem, you can have a disc problem, you can have a ligament problem, you can have a nerve entrapment problem, you can have a soft tissue problem, and you can have a tendon problem. So what do I consider soft tissue? It's going to be ligaments. It's going to be nerves getting entrapped. It's going to be soft tissue. And it's also going to be like in the muscle and the fascia. And what do I consider structural things? Bone, cartilage, disc, and tendon. So what does degeneration even mean? When I explain it to my clients, I'm like, oh, you're showing signs of degeneration. They're like, oh, what's that? Basically, it just means that things just got older before their time. And when I'm doing a history and a thorough evaluation, remember, I'm teaching you how to think critically. Ask questions, use your brain, work smarter, not harder. Ask a bunch of questions. In my initial consultation, there's 12 of them in total, but some ones that I'm really diving into and the idea of like, is this going to be more of a tissue problem or more of a structural problem? Was there trauma or not? A lot of times when there's an injury to an area and they're having pain, that's going to be a problem that's going to need to be addressed right there in that area. But a lot of times when there's no actual trauma or no problem, a lot of times that is a compensation from there. And then also with the degeneration, I'm just looking at age. The older you get, the more likely you're going to have problems in there. And then just their activity, like what do they do for recreation? What do they do for a job? Are they beating the hell out of their body? Are they running thousands of miles a week? Are they stuck at a desk all day? I don't know. Are they a manual labor person? Something like that as well. So the medical system really gets this wrong. You'll end up at the orthopedic surgeon's office and you get an MRI and they're like, I have degenerative disc disease, or I have a partial tear of the tendon, or I have cartilage damage, and it's just how it's going to be. It sucks for me. I got degeneration, and they want to treat the degeneration. But the problem is the degeneration is the effect. It's not the cause, especially if you don't have any direct trauma to it as well. So what is the cause? The cause is soft tissue problems. I like to call it scar tissue because it gets people's attention more. Some people like to call it adhesion. I like to say scar tissue. And it starts in the fascia. It starts in the ligaments. It starts in the muscles, and then eventually it spreads out and gets to the nerves and causes a lot of problems. So we get those, I call them the bullshit physical therapists out there. They might say, you know, scar tissue or adhesion isn't even real. And if it is real, it takes superhuman strength to ever fix it. They use the same freaking study every time about something with fascia in the foot and how it takes superhuman strength. They cannot understand that muscles and fascia and ligaments and nerve entrapments can be different, and it's a gray area instead of like black and white. In all honesty, those people are just mad because they went to school to be a glorified personal trainer and they can't fix shit themselves. So why is treating the scar tissue and the bad tissue so important? So I always say when I explain to my clients, I'm like, hey, here's what you got going on. You got scar tissue. You also are showing signs of degeneration and you have inflammation. So I always say, think of the degeneration as your thumb and it's stuck inside a car door. The car door is all that scar tissue. You can't give this a chance to heal up until you remove all of that scar tissue. So when people go and they jump right away to like, I'm going to get surgery on a partially torn tendon. I'm going to have surgery on my disc. I'm going to have surgery on my meniscus. The problem is, if you don't clean up that scar tissue first, it's going to come right back. It's almost like you pulled it out of the door real quick, but then eventually it slams down in there right away. So we need to know that degeneration is in there. Now we don't directly treat the degeneration, you know, and that's what the question was, like, can I directly treat the degeneration? You can't treat it directly, but you can unload it. You can't give that degeneration a chance to heal up till you unload all the bad tissue around there. I read a really good book. I forgot what it was called, but it was by an orthopedic surgeon. I think it's called like Back to Normal. And basically he did all these surgeries and he's like, man, I was doing all these surgeries and these people weren't any better. And then what he realized was it was more of a tissue component and lifestyle and inflammation, stuff like that. Yeah, more conservative care, not these big, bad, expensive surgeries, which just don't work and make problems worse. And they wonder why we're in a pain pill epidemic. But you, as the clinician, as the provider, this is where it comes back. You need to know what's going on with the client. You need to know that degeneration is in there, because what you're going to need to do in between visits is help them manage load. So an injury in the simplest standpoint is load versus capacity. I always say it's like a teeter-totter. On one side is load, what they do. Capacity is the other side, what they can take. So when load exceeds capacity, that's when an injury happens. So you as the provider, you're helping them fix the capacity by fixing the scar tissue, fixing the fascia, fixing the ligaments, removing the nerve entrapments, and then they can do more load. But if they're doing a ton of load in between while you're fixing the capacity, it's never going to get any better. I always give the analogy to my clients. It's almost like I treat you for diabetes in the office. You do really good. Then you go out to the car and eat a whole bag of cookies. That's what happens when they don't manage load. So knowing that they have it in there, you can tell them correctly what to do, what not to do, and how you're actually fixing the problem. Lessons and take homes from the video, I say this all the time, is focus on critical thinking and be a clinician first. Don't just jump into treatment because you have an intuitive feel about what's going on and you can just sense it by the way they walk. That's such bullshit. I'm so tired of seeing all that nonsense on the internet, all these people like, oh, I'm an intuitive healer. You don't know shit. You ain't fixing shit. And next is educate the client better about what is going on and what they can and can't do. You can't compromise with load. You know, you got this client that comes in and you're treating them, but then they go do a ton of dumb shit in between. And then you're like, oh, they're not any better. It's because you didn't tell them what to do. You're afraid if you told them that they had to cut back or they needed to stop doing an activity that they weren't going to come in anymore. You're like trying to be their friend and you're trying to be the clinician that tells them what they want to hear instead of what they need to hear. You got to be honest with them and you have to help them solve the problem. You're the leader. You're not going along the journey just being like, oh, do whatever you want. Tell them what's wrong and how you're going to help it and how they can help out in between, because it isn't your job to do all the heavy lifting. Your job is to help them along the journey, but you can't do it all yourself. So if you like the video, share any insights or epiphanies that you might have in the comment section, like kind of changing your mind around critical thinking and figuring stuff out. You can also do me a solid by sharing this video to your network to help other providers learn how to be different, how to be better, and how to be more critically thinking focused. And then also you can go in and download our no charge training modules. They're honestly better than any paid course out there. And then actually download them and finish them and go through them. And then if you like what you see, you can reach out for some courses in our in-depth immersive courses that are included for CEU credits to really help you get on the path to being a true solutions provider and get so damn good they can't ignore you. Appreciate you guys watching this one, and I'll see you on the next one. Bye.